Early behavioral family therapists found good results with their approach, but those results faded soon after treatment. Why might that be? What are the differences between a purely behavioral family therapy and a cognitive behavioral family therapy approach? And what benefits might there be in using a cognitive behavioral family therapy approach? This is Isabella, and these are the prompts I'm going to respond to for this week's critical thinking discussion. Behavioral therapy is rooted on Skinner's theory of rewards and punishments. He believed that the best way to understand behavior is to look at the causes of an action and its consequences. He called this approach operant conditioning. B.F. Skinner was the 20th century's preeminent psychologist, and they say this given the comparison of Freud, who many people might think to be the much more prominent person. But to scientific psychologists, to those who study in labs, there is no competition, there is no question. He started early at Harvard in his career as a graduate student, and then he went away to the Midwest for 20 years, came back, and then remained until his death. And his main contribution was twofold. First, in the form of an idea. The idea being that if psychology is to be a science, it cannot study anything that is not directly observable. He did not deny the existence of the mind, but believed that if you really wanted to be a real scientist, that you wouldn't study the mind because that was a black box. You could not directly perceive it. What you could see directly was behavior. And so this was an important concept that he came up with. And he designed recording equipment boxes to measure animals' responses in the face of what he called reinforcements. The idea was a really very simple one. If I want to increase some behavior in you, say for example, a positive behavior like helping, what I need to do is make sure that every time you do that behavior, I'm going to give you a reinforcer. Like a smile perhaps, a cookie, maybe. He broke this important concept of how do we change people's behavior? How do we shape them? He believed very much that who you came up all wired up to be was much less important than what the world or the environment could do to you or shape you. So before Skinner, psychology relied on something called the method of introspection. You ask people to think about things and they talk about them. And what J.B. Watson, who influenced Skinner, and what Skinner did was to create a complete departure from that. They said, there is no place in science for asking people questions and telling us what's on their head. We have to measure and know objectively that with an increasing number of reinforcers we give to a rat, what is the exact shift in behavior? So it was that precision, it was that focus on objectivity that they brought to our science and has shaped it forever. So this idea of Skinner was particularly effective with children because parents have control over their rewards and punishments. Gerald Patterson pioneered behavioral parent training, basing it on the idea that if parents change their contingencies of reinforcement, then their children's behavior will change. And so in the 1970s, behavioral family therapy evolved into 3 packages. There was behavioral parent training, behavioral couples therapy, and there was sex therapy. However, behavioral therapy failed to take into account the role of cognitive and inherited factors in learning. We are not born with empty slates or an empty mind or what they call a tabula rasa without preconceived ideas or rules for processing data. For example, they found that in primates, they often seem to solve problems in a flash of insight rather than be trial and error learning. Social learning theorist Bandura suggested that humans actually automatically learn through observation rather than through personal experience. And so thus it is an incomplete explanation of the learning process in humans and animals. Also, psychologists argue that we cannot generalize from studies on animals to humans as their anatomy and physiology is different from ours, and that they cannot think about their experiences, they cannot invoke reason, patience, memory, or self-comfort. And just as with any good idea, there were again other good ideas that came in to take their place, and of course that happened to Skinner. He was quite unhappy with how psychology turned later, and because most of the psychologists turned to cognitive psychology in one sense or another. So they wanted to study the mind, they wanted to know how the brains work. And like Skinner, cognitive behavioral therapists believe that they have objective techniques to do that, so that they're not introspectionists like the original psychologists were, but they no longer are like Skinner, in a sense that they don't believe that they can try to actually study the mind in and of itself. Cognitive behavioral therapy refers to those approaches inspired by Albert Ellis and Aaron Beck. According to them, our emotions are not caused by the situation themselves, but our thoughts about those situations. Beck suggested that our cognitions are responsible for our emotions, and by understanding those cognitions, our beliefs, our attributions, our expectancies make it possible for us to identify factors that trigger and maintain these dysfunctional emotional and behavioral patterns. And it boils down to uncovering hidden assumptions or underlying assumptions that keep people stuck. So cognitive behavioral therapy, when applied to families, takes a more expansive approach by focusing in greater depth on patterns of family interaction, and they believe that the ability of families to resolve conflict or tension is in part dependent on their communication skills, and also on the ingrained ideas that or ingrained beliefs of family members about individual or about the family functioning, which cognitive behavioral therapists refer to as schemas. What cognitive behavioral therapy is selling us, and what I love about it, and I think this is the main difference between the two, is that we actually have a lot more control than we think. We have the power to change things. Our external situations, our interactions with others, the negative events are not responsible for our moods and our problems. With cognitive behavioral therapy, you can learn to change the way you think, which in turn shapes the way you feel. And all of that then changes the way you view the world and how you handle difficult situations when they do arise. I would rather, and in that sense, it's actually a positivistic and optimistic way of viewing human nature, as opposed to Skinner's view, mechanistic and deterministic view of human nature, where freedom is actually just an illusion because you are controlled by something that is outside of you that you cannot have actually control of. So what are the benefits of using cognitive behavioral family therapy? It is considered to be one of the most rapid theory there is in terms of getting quick results. So it is brief, it's time limited, and it is cost effective. It appeals to clients who value a proactive approach to problem solvings and building skills that families can use for future difficulties. It is a very much goal-oriented approach, which means that it's highly effective in addressing the goals that you actually set for yourself. It's also highly collaborative in nature, in that you and the therapist collaborate in relation to your therapeutic journey. And so the person has actually a lot of empowerment in that regard, and they are much more involved, and they are the expert in themselves. Cognitive behavioral therapy also is practical in that you are given homework assignments that transforms into a 24-hour experience. And when done over time, it serves to be the forerunner of what will become the newly acquired behavior. And because it lends itself to research, cognitive behavioral therapy has proven its efficacy in both clinical and empirical researches for a wide range of psychological problems, especially the treatment of anxiety and depression. And because of that, it has become mainstream theoretical approach. And because of its adaptability and the degree to which it shares with other models of treatment, an assumption that a shift in behavior, in cognition, affect, and behavioral realms, its integrative potential has been recognized. Also, I think that you become more rational. You think and believe rational things instead of allowing your automatic negative thoughts and feelings to control your behavior. So you also learn to control your thinking, because you learn strategies to stop unwanted thinking and learn to think clearly and rationally. And because you feel more in control of your thoughts, your belief system, and about yourself changes, you develop confidence in yourself. So your beliefs about yourself change. And because of those things, you can calm down and relax. So the first thing you learn in anxiety, social anxiety therapy, for instance, is to respond to anxiety in a different way than you have in the past. And anxiety no longer frightens you or freaks you out. And you learn to approach it with calmness and peace, and you learn to handle situations in a more relaxed and less anxious manner. And because you expect things to turn out, because you change your thoughts, your beliefs, you begin to expect more rationally, and therefore you expect better outcomes. And the better you are at disrupting negative thoughts, the happier you will be. So there you go. That concludes my discussion, and I can't wait for your feedback. Bye.